Well, I think I primarily, after trying it and doing some research on the new technology with it, I really feel like actually the massage motion and the stimulation of the gum tissue is what I'm really excited about. The evidence is pretty good. I've just seen the research, of course, today on most of the IO research, but it's just remarkable how different it is, how much more positive it is than a manual toothbrush. And we already knew that the oscillating toothbrushes were 35% better, but now with this, it's even markedly better than that. So this is going to be very exciting. I was currently using the Genius toothbrush, and then now, of course, using this new IO technology toothbrush. I found that I really liked, my mind started working on what do I like better about which head and so forth, and I really liked the new daily clean mode that was really felt like my teeth were as they always said, you know, just felt like I just had them polished or just had them cleaned. And then the sensitive one, my mind started working kind of that I liked the sensitive one, and I felt like it's going to be really applicable towards implants and towards the patients with the full fixed arch crowns, you know, the ones that have the veneers, the ones that have a lot of restorations in their mouth. I think that's going to be a really big bonus to use the Gentle Clean head for that. So I was starting to think about, as I'm using it myself, which application would be best for which head. I think that I really like the positive green light system. You know, they always had the red light when you were brushing too hard, but then you really didn't know, how do you compensate for that? How do you change your pressure and know when it's right? So I found myself watching the green light area and then watching the timer and knowing that, oh, I should be brushing longer. And, you know, it felt so good that I wanted to brush longer. So I think I think the green light, positive reinforcement, the timing on the brush, and then just the positive smile face or winks and things like that, or the good morning, are going to be really fun for patients. Okay, so I would think that it will be applicable to all the patients to use that technology, and I think for particularly our crown and bridge and any tooth-borne restoration patients are going to benefit because of the stimulation. The crown patients don't get stimulated like natural teeth do. So this technology and the way it's set up to do the really nice, gentle micro vibrations is really going to help those patients a lot. So I'd say anyone with any tooth-borne restorations and implant-borne restorations, it's going to be very positive. I think that, you know, now with electric toothbrushes being the American College of Prosthodontics guideline for the removal of biofilm, it's going to encourage a lot of dental professionals to realize that electric brushing is really a must with biofilm elimination. So this gives them a really positive toothbrush that they can recommend to their patients.